Hi everyone. Let's talk about transmembrane potential. So we have an example of a cell, and we already know that there are a number of positive and negative charges both inside of the cell and surrounding the cell in the interstitial fluid. We know that there are protein anions inside of the cell that are kind of big molecules that are negatively charged. We know that there are a number of potassium ions that are positively charged, and a small number of sodium and chloride and calcium ions. And then in comparison, in the interstitial fluid, we have a high concentration of sodium, calcium, and chloride and a low concentration of potassium. So without considering these ions in too much detail, let's focus on the charge and the magnitude or the amount of charge just for a couple of moments to explain the idea of transmembrane potential, and then we'll kind of come back and talk about some other things that are related. So we know about charge that opposites attract. Positive charges attract negative charges, and negative charges attract positive charges. So when we consider the arrangement of ions inside of the cell and outside of the cell, we could say that the cell membrane separates the charge. The cell membrane is a barrier to the positive and negative charges coming near each other from the inside of the cell to the outside of the cell. Now we also know that in terms of the cell membrane properties, the cell membrane is not able to allow for transport of positively charged or negatively charged particles across the membrane without the use of a specific transporter. So when we mentioned previously that the membrane is selectively permeable, the membrane is separating the charge because if there aren't any transporters, then there's no way for that charge to actually move across the membrane. So when we say that positive and negative charges are held apart across the membrane, we can say that a potential difference exists between the charges. So I imagine that the word's potential difference is a little bit unfamiliar in comparison to some of the other things that we've mentioned. So I want to sort of interchange the words potential difference for potential energy, because that's essentially what we're saying, that because we're holding these charges apart, we are harnessing potential energy that we can use to power activities. So when we talk about things that are moving down their concentration gradient, what really is happening is we're utilizing potential energy and converting it into kinetic energy as those molecules are moving. So a potential difference across a cell membrane is called transmembrane potential. So that's actually what we're talking about. When we refer to transmembrane potential, we're really talking about potential energy. The unit of measure for transmembrane potential is volts or millivolts. Now, in terms of cells are super tiny, so we're really going to just use millivolts. And the abbreviations are capital V for volts and then a lowercase m capital V for millivolts. The transmembrane potential of an undisturbed cell is called the resting potential. We make a point of mentioning that because the cell's not always going to be at rest. We have this idea of excitable cells that have massive changes in membrane potential, and we're going to kind of talk about how that happens. So when the cell is kind of resting and not doing anything, there's no net movement of charge, we can generally classify it as the resting potential for that particular cell. So let's talk about how we can maintain the resting potential of a cell. And this is going to take us a little bit to kind of get this a full understanding of this concept. So I want to introduce a couple of other ideas to make this a little bit easier to understand. So the first is a chemical gradient. So we've so far referred to a concentration gradient, and we've referred to a pressure gradient in the context of filtration, but we haven't really said the words chemical gradient before. So the chemical gradient in the context of resting potential is the difference in ion concentration inside of the cell compared to outside the cell, and it will be for a specific ion. So for example, the concentration of sodium inside of the cell compared to the concentration of sodium outside of the cell. And we can contrast the chemical gradient with the electrical gradient, which is the difference in the sum of the charges on the inside of the cell compared to the outside of the cell. So when we think about charge and then we think about chemical concentration, we have sort of two factors that are playing a role in maintaining the resting potential. So let's take a look at a cell and kind of expand on these ideas. So let's use minus 70 millivolts or negative 70 millivolts as our resting potential for this cell. Now, resting potential values can vary between different types of cells, but negative 70 millivolts is actually the value that we're going to use for neurons. And so because that's our first look at excitable cells, we'll use minus 70 as our start value. So let's consider in this particular cell, let's consider the differences for potassium. So we know that there's a high concentration of potassium inside of the cell and a low concentration of potassium outside the cell. And we also know that in terms of contributing to the negative charge on the inside of the cell, we have protein anions, so negatively charged proteins. So if we were to consider the chemical gradient independent of anything else, we could clearly see that there is far more potassium inside of the cell compared with outside. And so the direction of the gradient is going to be from the inside to the outside. The potassium, given the choice to move down its gradient, moves down a chemical gradient from the inside of the cell to the outside of the cell. Now, conversely, potassium is a positively charged ion, and the potential inside of the cell compared to the outside of the cell is negative. So we actually would want to, if we were considering the electrical gradient alone, drop potassium ions into the cell. So electrical gradient direction is into the cell. So it turns out that the chemical gradient is actually a much stronger force than the electrical gradient for potassium. And so we have a net flow of charge out. Given the opportunity to move in any direction, down the gradient, when we consider the chemical factors and the electrical factors together, the net flow is going to be out of the cell. That's where the potassium wants to go. Now we could compare that to sodium. So we know that we have our negatively charged protein anions inside the cell. We're still at minus 70 millivolts. And we also know that we have the positively charged potassium ions. And then there's an abundance of sodium ions outside the cell and very few inside of the cell. So if we consider the chemical gradient alone, the sodium wants to move into the cell down its chemical gradient. And then if we were to consider the electrical gradient alone, sodium is also a positively charged ion, and it's drawn to the minus 70 millivolts inside of the cell. And so as it turns out, these two forces sum together for sodium, and the net flow is going to be into the cell. So what this tells us is that we can consider the chemical gradient and the electrical gradient together. It actually forms the electrochemical gradient, and it's the sum of the chemical and electrical forces that act on an ion across the membrane. So obviously for this sort of theoretical example, we're not spending any time thinking about what specific membrane transporters are present, but let's just assume that we had, say, leak channels, and we had the opportunity for these ions to move until they reached a point of electrochemical equilibrium. So until we were kind of at a happy place between the electrical factors and the chemical factors, let's first start with potassium. Potassium, we know, is going to have a net flow out. It actually will flow out until the membrane potential on the inside of the cell reaches minus 114 millivolts. So the force of flow is so strong that the potassium is going to keep moving out of the cell until minus 114 millivolts. And then at that point, it's considered to be at electrochemical equilibrium. So at negative 114 millivolts, we could have potassium flow into the cell and potassium flow out of the cell, and no net difference in potassium flow. So this is something that we're going to sort of file away for later, because when we talk about some of the other things that are going to happen with the cell, this is something that we want to be able to keep in mind. And we can contrast this with sodium. So we said that the net flow of sodium is going to be in, and the sodium actually, given the opportunity, so let's put some leak channels in that membrane, given the opportunity, the sodium will flow in until it reaches a membrane potential of plus 69 millivolts. So it actually is going to flow in until we reach a pretty significant positive charge. And at that point, plus 69 millivolts, the sodium would flow in and out of the cell sort of at equal rates with no net flow at that point. So I think memorizing the numbers is maybe not that important, but keeping in mind the context. The desire of the potassium to flow out is so strong that it will reach an equilibrium point of minus 114 millivolts before it stops. And the desire of sodium to flow in is so strong that it would reach a membrane potential of plus 69 millivolts until it stops. So let's talk a little bit more about maintaining the resting potential. So we know that we're starting with minus 70 millivolts, and I do want to kind of offer a minor point of clarification, which is that the inside of the cell, like the center of the cell, is not supremely negative. What we're really comparing is like the membrane directly inside of the border just inside the cell where the membrane is, and then the border just outside of the membrane. That's where the true difference exists. But when we consider the cell, we sort of generically refer to it as the whole thing. So we know things that maintain the resting potential. Number one, there are protein anions inside of the cell. So that's giving us some negative charges, and we know that those guys are too big, they can't leave. There also are a ton of potassium leak channels in the membrane. So it's not that we couldn't have sodium leak channels as well, but we just have generally a greater abundance of potassium leak channels. And those potassium leak channels, they have pretty good conductance, and the potassium ions want to leave. And so the presence of the potassium leak channels means that potassium actually has the opportunity to flow out much of the time. Now, the potassium leak channels it's not overly significant. It's just a contributing factor. So we don't want to kind of consider it out of proportion with the other things. And the last thing is the sodium-potassium pump. So if we do lose these potassium ions to the outside of the cell, we can actually pump them back in using the sodium-potassium pump. And similarly, we can pump the sodium ions back out. So we sort of like keep the original electrochemical concentrations and gradients that we started with. Now, we mentioned a couple of times that the resting potential can change, particularly when we consider excitable cells. And so the two things that can happen with resting potential is that we can actually have an ion flow that causes a graded potential, and then we can have ion flow that causes an action potential. So we're not going to explain either one of these things in this video. We're actually going to do separate videos on both those concepts. But I just want to introduce the terminology to sort of show the parallel. When we talk about resting potential, we're comparing resting to graded in action. So it really does sort of connect to other things. And so in resting potential, we have potential energy. In graded potential and action potential, we're converting that energy into kinetic energy. We're using the difference of charge to power some work that we want to do. Now, I also want to suggest that when we talk about graded potential and action potential in excitable cells, what we're talking about is the opportunity for significant change in ion flow at a given time. So let's take, for example, flow of sodium ions into the cell. So we know that we have ion channels that can be used for sodium entry. We have voltage-gated ion channels and ligand-gated ion channels, and so both types come in a specific form for sodium entry, and so we can allow for sodium entry into the cell. Now, one thing that is really important about sodium is that when we have a massive flow of sodium into the cell, there could be a desire for water to flow in as well. So sodium entry into the cell could often be followed by, and if it was sustained over a period of time, it could be followed by water entry into the cell. So we have this water follows solute sort of gradient thing that is happening with different types of cells in different areas of the body. And sometimes that's happening on purpose, but occasionally that can be a problem. So I just want to sort of make the suggestion that if we have an accumulation of sodium ions inside of the cell, we're increasing the solute concentration, which is essentially what we're saying, then if there's a sudden increase in solute concentration inside of the cell, that means that the solution has become relatively hypotonic, and now this cell sitting in a hypotonic solution created by the sodium entry into the cell is going to draw the water into the cell in order to balance that out. So what we do is we use the sodium potassium pump. So as we mentioned before, to restore the potassiums back where they belong, but also to restore those sodiums outside of the cell so that we don't have this massive flow of water into the cell. So not only does the sodium potassium pump function to maintain the resting potential, it also functions to maintain the osmotic balance of the cell with respect to its in the environment of the interstitial space. So I want to just talk about how this can lead to cellular death. And there's, of course, much to say about the pathophysiology of cell functions and how they can kind of go badly. But here's a progression that's really, really, really important. So let's consider a patient who's having severe difficulty breathing for any number of reasons, whether it be asthma or acute pulmonary edema, something that impairs oxygen delivery to the blood. If you have impaired oxygen delivery to the blood, that means that the blood is not going to be able to transport the oxygen to the cells wherever that oxygen needs to go. If oxygen doesn't arrive at the cells, then the cells are not able to efficiently make ATP. And so we could essentially say that we're going to make no new ATP. There is a way to make a tiny bit, but it's not going to be enough to get done everything that the cells really need to do. So we'll essentially say no new ATP. We know that ATP is required to power the sodium potassium pump. So if we don't have ATP, the sodium potassium pump will fail. And if the sodium potassium pump fails and we still have sodium ion accumulation inside of the cell, we now have created an increase in the osmotic pressure. We're going to draw water into the cell. And of course, we know that when we draw a lot of water into the cell, it's going to cause cellular rupture or cell death. So this is a very important progression of cellular disease. And when we think about something like asthma or acute pulmonary edema, these things that, we observe patients for difficulty breathing, and that's really kind of what we're focusing on. In the end, what really matters is the impact of those things at the cellular level. That's what so much pathophysiology comes down to. The very fact that the person is having difficulty breathing means that on a cellular level, the cells are going to die because they're not getting oxygen, they're not getting ATP, and they're not able to regulate the ionic balance inside of the cell. So it's just kind of an interesting thing to consider, because it's very easy to just sort of consider the patient presentation at the surface, and really most of the things that are really going wrong, they're going wrong in the tiniest sort of form in the cells. So transmembrane potential is really, really important in terms of cell function and also maintaining the membrane potential is really critical to the cells continuing to survive. So like I said, we're going to expand. When we talk about excitable cells, we'll talk about the graded potential and the action potential, and sort of show how we can have these dramatic changes inside the cell beyond our sort of resting state. So that's all for now. Thanks for watching.